So I actually really want to ask you about filler because it's something I feel like you see. It's almost as common as I don't even know, like a facial. Yeah, Botox. It's like people are just getting it all the time. Everyone's posting about it. It's making it seem very casual. Like, do you think it's something that is that easy or like doesn't have to be taken that seriously? Like, what's your take on it?
I think the role of filler is as a replacement for your natural volume. So when you see volume loss in an area, you'll notice that because you'll feel heaviness of your cheeks or hollowness under the eyes or jowling around the mouth. So the purpose of filler is to replace the youthful fat pads that are under your skin. As you age, and even starting in your 20s, you might be a person who's always had hollow under eyes because you were just never born with those nice fat pads. But as you age, everything atrophies, thins, deflates, and droops.
Yep.
Yeah, and so you need to really look at filler as a replacement of the natural fat pads of your face. Like, look at this. This is a great picture to show you that. So this is a young, youthful face, and look how dense the fat pads are and how they're tightly together and plump and juicy. And this face, the aging face, why does she start to get drooping and sagging? It's because of deflation and thinning of atrophy of those fat pads, and they spread apart. That's where you get the under eye hollow. That's where you get the nasal fold from, right?
Yep.
So when I use filler, I'm really recreating the youthful fat pads of the face. So filler can be exaggerated when it's overdone, when you have an injector who doesn't understand beauty and anatomy. And I think that that is the art of filler. And if you overdo filler, you also start to forget what you used to look like. So it's so important. In our office, I track people's faces and I give them a beauty plan and I photograph them and I remind them what they used to look like.
That's interesting.
Yeah, when you do your lips, immediately your brain resets to this new, like, this is my lip, it's always been like this, but that's not the case. So, so if you're someone who has big cheeks and you're like, oh, I liked them when they were bigger, well, let's go back to where you used to be and let's remind you what's natural.
And do you think some people have a fear that like doing filler, you know, maybe starting in your mid-20s or young 30s, like, does it stretch out the skin? Are there any long-term effects?
So that's a completely unfounded and really good myth to bust because it does not. In fact, everywhere you put filler, you stimulate collagen to grow. And
even like Juvederm or
even Juvederm
Voluma?
Because there is a needle stick, because there is some minor bruising, there is some platelet-rich plasma released, and there is some foreign body reaction, right? Your body knows it's not your own hyaluronic, so there is some metabolism and changes for aging.
Okay.
So I do think it perks up every skin type, but the best fillers like Sculptra, the biostimulators, the radiuses, they stimulate new collagen and growth, so you get a scaffolding of nice, pretty collagen left behind. So each filler kind of improves your outcome.
And do you Sculptra, you don't do on the face, do you?
Oh, yes.
Oh, really?
Yes. So it's FDA approved for the last 20 years for the face. And that was the original use for it. It's not FDA approved for the fancy areas like the butt and other spots where I'm using it.
Because it lasts so much longer.
Yes,
right,
and the face, it's such a nice rejuvenator. So someone who's really thin like yourself, all my athlete patients, people who've lost a lot of weight, so you have already a little hollowing in your temple. And as we get that temple hollowing, it's a matter of time before the upper eyelid feels heavier and before you start to get a little bit of, sagging around the lower face. So temple filler is terrific. Sculptra is a foundation builder. I love that idea because the immediate fillers are wonderful, like your Juvederm, your Voluma, but you're renting that for a year.
Exactly.
You're going to put that in there, it looks terrific, and you're going to see me in a year.
I think what about the fear that, like, if you don't like it, well, I guess, a year is still a long time if you don't like it anyway. So
well, all your hyaluronic fillers can be dissolved if you don't like them. So
can Sculptra?
Sculptra cannot be dissolved. Right. So you need to see an injector who's super good with their anatomy, and it's, a particulate filler, which has more risk. If it's injected into an artery, it can cause an occlusion. So super important to have someone who knows their stuff, so you don't cheap out on them. But I love it because it is long-term. It's a 2-year product, and the collagen that you grow can last 5 to 10 years, and it just maintains you. So it's like the fountain of youth. All of our really skinny actresses, like the Madonnas, the Angelina Jolies of the world, who have, like, they're so skeletal.
Right.
You see them in real life, they're so skeletal, but their faces are volumized and gorgeous, right? Like, they look amazing because they're maintaining with Sculptra. And some of our male actors, like the Matthew McConaughey's, who get all rugged and lose like 50 pounds for a movie, and then their face shows it, and then for the next movie they look great again. Like, facial fat doesn't work like that, but Sculptra does.
It does. Wow. Okay.
Yeah, so it's sort of like the smart woman's amazing way to stay natural and lift it.
And what's cool is, like, like the temples, like even myself, it's not even something I would ever think about, and maybe it's not something someone would be like, oh, their temples are showing they're old, but it's something that's just unspoken, and maybe you look at someone and be like, oh, she looks more youthful, and like,
yes, the temples is such a crazy hidden area of aging, but your brain has this amazing supercomputer ability to compute someone's age based on how thin they look here and how their cheeks look saggy or droopy. So the two things I would say to really work on to maintain beauty, temples and cheeks. Those are my two favorites.
That's interesting.
Yeah.
I have to consider temples.
You should consider
I
it.
will, because it's not.
Consider
It's
some
also.
Sculptra. I tell
It's
everybody.
not a scary area either. Like I don't think it can. I don't know. I'm not
Yeah,
that
you
worried,
can't really
like,
get distortion of your face too
Yeah.
much. Like you can get some nice, pretty sculptured temples easily. But I think if you're someone who's getting Botox, you're getting it because you notice crinkling and dynamic motion, like especially around the eyes. So you'll reach a point where there's not enough neurotoxin or Botox to stop the crinkles because you have volume loss, right? Your face is like a balloon. When the balloon loses air, you get more crinkling.
Yep.
So you can put Botox there to smooth those, but if you really want a nice, pretty balloon, you need volume again. So think about that if you're someone who's getting Botox.
Interesting. I love that. Okay.
Yeah. Well, tell me some tips for my clients about your area of expertise, which is like, if I wanted to go vegan, what are some of the things I can do?
Right.
To go plant-based.
I really think. I mean, I always say too. There's a lot of vegans or people who talk about plant-based diets who are maybe a little bit judgmental. I don't think that's the way to go. So even if